everyone. Hello, everyone. It gives me immense pleasure to welcome a professor of ICT Mumbai, our own Professor Prashant S. Kharkar, to this interview. Sir, we as a team of Bombay Technologist and I, Shomik Singh, the student editor of Bombay Technologist, wholeheartedly welcome you for this interview. We, first of all, we like to take a look at Sir's glorious and marvelous academic as well as research career. Sir graduated with his B.Pharm degree from NDMVPS College of Pharmacy, Nasik in 1998. He secured an All India rank 1 with 99.96 percentile in 1998 in the GATE examination, which led him to pursue M.Pharm and PhD from ICT Mumbai in 2000 and 2004 respectively in pharmaceutical chemistry. He further went to Wayne State University, Detroit, USA, to obtain his postdoc in 2009 in medicinal chemistry. His main research interests lie in design, synthesis, biological evaluation, and preclinical development of new chemical entities as therapeutic agents, discovery of novel cancer stem cell inhibitors, and development of novel fluorescent probes for biomedical applications. Sir has worked in industries like Reliance Life Sciences Private Limited as an executive in cheminformatics, as junior research scientist in Nicholas Piramal India Private Limited, as research scientist in Piramal Life Sciences Private Limited, and also as a senior research scientist at Nycumud Pharma Private Limited. Along with his industrial career, he has also been at part involved with academics, working as a professor in SVKM's NMIMS Mumbai as a lecturer in pharmaceutical chemistry in Bharati Vidyapit's College of Pharmacy, Navi Mumbai, before finally joining our college, Institute of Chemical Technology, Mumbai, in 2019. Throughout his academic career, Sir has over 70 papers published in both national and international journals, has undertaken several research projects in his tenure. He is also a regular member of the American Chemical Society. He was recently included in Stanford University's famous top 2% researchers list. This list contains top 2% of the world's most cited scientists in the field of engineering, chemistry, agriculture, fisheries, forestry, enabling and strategic technologies, and clinical medicine. He also received his first US patent in 2021 and has been also included as a life fellow in the Indian Chemical Society due to his work. Presently, he is the professor in the Department of Pharmaceutical Science and Technology, Associate Dean of Academic Programs, President of Institute Innovation Council, and also the coordinator of ICT NICE SM Mokashi Incubation Center. Sir, it's a great honor to interview you and talk to you.
Thank you so much, Soumik. I can't be more excited. Thank you so much.
So let's move on with the questions. So my first question to you would be that since we are children, once we are in school, everyone has diverse interests. So one is often quite very unsure that what he wants to do in his life. So what made you choose pharmacy as a career over other subjects?
Well, this is actually a very interesting question for the same reason that everyone's life journey is so very special to them, very close to their heart. In fact, it was merely by an accident as in not in literal terms, but since my childhood, I was always, I always wanted to do something different, right? So, and in fact, since my childhood, I was always fond of looking at medicines, and then maybe, I did not know how to discover a drug or how to bring a new medicine to the market, but I had this childhood dream of discovering a medicine. And when I actually came to pharmacy, then I came to know it's not a single person who actually can, discover a drug or something. But in 12th, like after 12th, I applied for mechanical engineering. Of course, chemical engineering. The engineering was the branch where everyone used to go. But then a doctor of medicine. Or MS actually, one doctor in my town, he advised us to try something different. And before us, it was only one student from my town who went to pharmacy, right? So I had one night. I already got admission in BE Mechanical Engineering at my district place, Dhule. But then that one night, I just thought, and then I spoke to people and decided that this is what I would want to do. And next day I did not go to take admission, and then I somehow just to pursue my childhood dream, I finally ended up in pharmacy. Unfortunately, I got one of the best colleges back then, that is Nasik College of Pharmacy, and that's how I ended up in pharmacy, and there was no looking back since then. So it was merely by accident, and I actually took a risk, if you ask me that way. Because my parents, they said, you decide what you would want to do, we would not say anything. If you want to continue with engineering, you do that, otherwise try something new. And that's how I came to pharmacy.
So, as I mentioned, and as I saw in your career profile, that you have worked in both industries as well as the academic field. So, what really makes your career path unique? And how I would like to also ask that how is working in the industry different from working as a teacher or a professor?
Yeah. So again, this is a very interesting question. Now, my boss in Nycomed Pharma, who happens to be my senior from my B Farm days, and again senior in ICT for my masters and PhD, Dr. Mahindra Makhija, he always used to call me a free radical. In the sense, I was so unstable. I tell you, after my after my PhD from ICT, I just got married, and I was staying in Navi Mumbai, CBD Belapur. So somehow I got in touch with a professor in Bharati Vidyapeeth College of Pharmacy. So she said, now that since you're waiting for industry, why don't you come and teach here? So that's how I ended up, since I was staying in CBD Belapur. So I went and joined Bharati Vidyapeeth College of Pharmacy. But immediately, like after 2 months in joining that job, I got interviewed at Piramal Life Sciences, and this is where I always, it was Nicholas Piramal India Limited back then. And that was in drug discovery. I always wanted to be in the drug discovery because that's what I was trained for, and then my childhood dream again I would want to pursue. So I applied in Piramal, and then I got selected, but then there was like 2-3 months gap, and that's how I continued teaching in Bharati Vidyapeeth College of Pharmacy. And then it was September 1st, 2003, I joined Bharati Vidyapeeth College of Pharmacy. In March 13, 2004, I left Bharati Vidyapeeth College of Pharmacy, and on 15th of March 2004, I joined Piramal. Now, again, I worked for almost 10.5 months, and then I got another offer from Reliance. Again, that was for monetary reasons. I actually changed that job. Everything was going very well. But then I bought a new house, and then because of salary issues, and that's exactly what you tend to do at the beginning of your career, and I was no different. So then I went to Reliance Life Sciences. The salary was good, the work was good, and meanwhile I got an opportunity for postdoc. So then I went for postdoc. Like I stayed there for 13 months, and then went for postdoc again. After 3 years into postdoc, I came back and joined the industry. So one very interesting difference what I saw was, now when you are in academics, say when I was doing my PhD, or even for that matter when I was working for my postdoc, so we had a liberty of trying out new ideas, and you could do anything and everything to satisfy your curiosity. Something comes to your mind, and you end up doing that. But then in industry setting, you have a defined role, right? So you have defined projects, and you have to work just the way the company would want you to. So again, not that there was no freedom to express ideas or something. Absolutely not. In fact, Piramal was fantastic. So was Reliance. In fact, in Reliance, we were a contract research company, and then we used to interact with a lot of foreign clients, and then we used to write proposals and stuff like that. So, but then they had a limited, they had a collection of therapeutic areas, and you just would do. And then again, like there were many ideas as a as a fresh PhD, you are full of ideas, and you would want to try out everything, but not everything would work out because everything costs money, and that's exactly where. So I somehow felt in industry, although everything was available, everything was at your disposal, but at times some of the weird ideas, weird in the sense out of the box ideas, that probably you wouldn't be able to do that, and that continued. But when I came to Nycomed after my postdoc, since I told you my boss, my senior was my boss, so and I was working for I was part of global molecular modeling team. So they had a very big R&D unit in Constance, like Germany Swiss border. So every 15 days I used to go to Germany, stay there, work with the German colleagues, and German colleagues, like Germans are perfectionists. So I had a very nice learning from those colleagues. Everything was going fantastic. There we could explore a lot of things. So one of the ideas which I actually wanted to try out wherever I went was drug repurposing. So meaning finding new uses for old drugs. It wasn't very popular back then, but now in COVID era, everyone knows what drug repurposing is. So then after that, Nycomed Pharma, it closed down because somebody else took them over. Then I thought maybe academics is the right suit for me, and that's how I ended up in NMIMS. So if you ask me the difference between working in industry and difference in academic, so the freedom to try out the ideas, some out of the box ideas which come to your mind, I think that's probably the greatest asset or greatest advantage of being able to work in an academic setting. And of course, academics, they have their own limitations in terms of funding, and you really have to struggle. But that's okay, as long as you are willing to do what you want to. There are enough people to help you. I've got a lot of collaborators, and that's exactly how I could flourish since my academic entry back in 2012. And I just continued. So I think the most important difference is to be able to try out ideas and satisfy your curiosity. That is the biggest advantage of being in academics.
So, sir, I would like to clarify that does industry somehow limit your innovative skills or limit your thinking power or to do something new, something out of the box, whereas academy provides you that, academics provides you that?
Well, I wouldn't say that, as in everybody's experience with in industry setting may be different. There are some people who are kind of cool with the routine job. There are some who are very ambitious, who would want to try out things and leave behind their mark. And in fact, wherever I went, I could actually do that. And of course, I did not stay for a very long time, and then that's how I did not really get good recognition for what we did because it was only a short span of time. So I wouldn't say that industry doesn't provide the freedom to innovate. Of course not. But then, like I said, when you have some real out of the world ideas, and if it doesn't really align with what the industry defines, what your role defines or what the industry is into, I think that's where the differences arise. But I had my own pleasure of working in industry. I learned a lot, but then somehow I think it was just the academics. So again, like I said, industry would be different for different people. I am very ambitious person. I'm very hardworking researchers. I'm very hardworking researcher, and I think all this time, I mean, my boss used to call me free radical for the same reason that if my curiosity is not satisfied, I wouldn't really spend my time there. I would just leave from there. So that's how.
So your record shows your hard work and your dedication towards your research. So my next question to you would be that as a professor of our college, Institute of Chemical Technology, Mumbai, what is that one thing about the job that you love the most? And if there is something that you could change about ICT, what would it be?
Okay. Well, the second question is a little tricky and I would say hard to answer, but I would answer the first part. Well, every morning when I get up, so I'm always, another thing is I'm very, very positive person. I have always tried to look at problems as opportunities, and that's exactly how I could turn them into newer avenues, and I could come this far. So as far as working in ICT is concerned, now ICT, the Vastu, and everyone in the ICT family. So I mean, you said that of course you mentioned I was all India topper. Again, I will just take you a little back in time, and then I don't really have to tell you what is it that about ICT that I adore so much. In fact, when I was in second year B Farm in Nasik, so there was one paper cutting in Times of India. I still have that. So it was about my senior from Nasik who came to ICT and worked with Professor VM Kulkarni. So that was around 1995, almost 28 years or 27 years ago. So this cutting was about discovering new medicines for HIV back then. So they were working on HIV protease. So there was this nice silicon graphics machine, and then the screen, and then HIV protease structure was shown, and how this my senior Tanaji Tarele, a very tiny guy. Now he works as a professor in St. John's University in New York State. So this guy, he was standing next to Professor VM Kulkarni, and they were talking about this. So then that one news changed the course of my career. I mean, of course, I came to pharmacy because I wanted to discover medicine or something, my childhood dream. But then this one news actually pushed me so hard that I had only one option left, that is to stand first in all India level, so that I could actually come and work with Professor VM Kulkarni. I mean, if you go back and see all the records back then, all India topper would come to ICT work with Professor VM Kulkarni. My boss from NICOMED, who was my senior, he was again from my BFAM college. So the same guy also worked with, like he stood first in at all India level. He came to Professor VM Kulkarni. His junior and my 1 year senior, Dushant Varshni, he stood first at all India level. He came and worked in ICT with Professor VM Kulkarni. So there is something so special about ICT, which is beyond any words, beyond any expression. So that obsession to come to ICT and work here, and believe me, this 5 years, 2 years of my master's and 3 years of my PhD, we worked so hard. Like every day we used to come to lab at 9 and then work till like 1:30 to 2. Again, go back to hostel, sleep, and again next day, 9 o'clock in the lab. So there was no, I mean, we were so inspired, so motivated, despite all all the limitations whatever we had back then. We were like 13 of us working in the same lab, and eventually we did what we could do. I submitted, my professor was to retire, so I was his last PhD student. I persuaded him to take me for PhD. He could manage the UGC seat, and eventually I registered for PhD, and I completed my PhD, like submitted my PhD 3 years, 3 days to 3 years, like 3 days to spare to 3 years since my joining date. And so I knew I had less time, and that's exactly, we worked so hard. So if you, I mean, this obsession with ICC, that continued all these years, and probably it will last till the last breath, no matter what people say about ICT. But we know what ICT is for us, and that's exactly what we try to imbibe on all our students. So this obsession is what I would say, which makes me to work so hard to come to ICT. Now, again, if you look at my journey, like when I left ICT and then when I came back to ICT. So coming to ICT is, again, it's even though you are an ICT alumnus, but it's not easy that, it's not a red carpet for you that you come and, will take you. Absolutely not. So it is on your credentials that you would eventually select. And there was a committee of all who's who would interview and finally could crack the interview. So it's all hard work all these years. And then this very, I would say, I'm sure you know about the secret, right? So if if you need something, your thoughts, I mean, the universe will make it happen. I think that the same thing worked for me as well. And that's why I came to ICT. And if you ask me, so this obsession is what drives me, and we would do anything and everything for the betterment of the institute, because whatever we are, it is because of this institute, because of our alma mater. It is the people of ICT, the alumni, the present faculty, the students, everyone contributes in what ICT is. And I am just one of those constituents. And unless I work hard, I cannot make my institute proud and keep the flag, flying high. That's exactly. So this one passion for doing the best is it comes from ICT itself. And about changing things, anything that I would want to change about ICT, again, it's difficult to say. I mean, I would say no institute or no organization is perfect. We have our own problems, our own issues, but ultimately it's us, right? So we make what ICT is, and so I would change myself if I have to change one thing about ICT. I would make myself stronger. I would make myself more passionate so that I can only contribute to ICT's name and fame.
That's a great answer, sir.
Yeah, if everyone thinks that way, I think we are already on top, but we will just go beyond
Definitely, sir.
any scale or something. Yeah.
Definitely, sir. So recently you started working as the president of Institute Innovation Council and also the coordinator of ICT and ICE SMO Kashi Incubation Center. So I would like to know that what does a typical workday look like to you? So you come to office and what do you do day to day in the day-to-day schedule?
Yeah, again, this is a very interesting question. I mean, you may say that I'm for every question I'm saying interesting question, but it is indeed an interesting question. So again, now apart from what all designations or roles I have, I am a teacher first. I'm a very passionate teacher. You can ask my students. I'm a very passionate teacher. So I would make sure I would follow the timing and everything. I will be, so basically whenever I have lectures, I will, rest everything takes a back seat. So my phone is on silent. It's, I don't see who is calling and all. I do not pick up any phone during that time. So apart from my lectures and practicals, whatever we do, so I in fact sit in ICT Nice, the second floor of IPC, and of course we'll have our own place very soon. So of course we do have a lot of incubators and pre-incubators coming up. So on any typical day, it's about interacting with students, whosoever would want you. Many students actually come and talk, and in fact, in recent times it has really increased, which is actually a good news, because we want the students to get motivated and come and join us as pre-incubators, or start their own company. And I think it is just a matter of time that it will get busier and busier. Apart from that, the regular work of ICT Nice. Now, the most important thing is tapping the student population, in the sense making sure that the students are aware of what is going on. So we try and organize a lot of events. And if you look at from the IIC or institutions innovation council perspective, so we have mandatory or mandated activities by Ministry of Education. So that planning goes on. Of course, there is a full IIC secretary and her team is there, and that's a fantastic team. Some of you may be part of it. So planning those activities, and apart from that, so then we also we are conducting some FDPs. We have recently got a grant from MSFDA, that is Faculty Development Academy of Maharashtra State, which will support organizing these innovation related programs for the next 3 years. We've got around 78 lakhs. So that's a lot of money actually. So on any typical day, the activities, apart from our academic activities, mostly we are talking about discussing as to how to take things forward in terms of, now in fact, we soon will be an entity. ICT Nice will be a registered society, and we will, so the formation of society, so the complete team, Dean Arai and Dr. Shamlan and others, all of us are busy working for that. And so basically majority of the work centers around the ICT Nice as well as IIC related activities. Like I said, most important thing is to be able to talk to students, to be able to inspire or motivate them in whatsoever possible way. That's exactly what we do. So yeah, and then believe me, in fact, this morning I was talking to someone, and then someone was telling, "Oh, you do so many things, but how do you manage time?" I just told that person that time management is actually a myth. Nothing works out because when you walk in your office, there's something comes in between, and you just have to attend to that. But if you see a typical day, all our activities are centered around students, and that's exactly as a passionate teacher I believe in. I believe in the very fact that we are here for students, and we'll make every conscious efforts to make sure that the students get a proper training. I mean, at times it becomes I shout at students, but I also tell them that it's because of it's for your benefit that I am actually making sure. I mean, I'm increasing my I'm letting my blood pressure increase because our teachers were like that, and that's exactly we just imitate our teachers. Right, so and at times you tend to become very obsessively very obsessive about the details and even the writing and stuff like that. So all those things keep busy, and yeah, a lot of things actually.
That's great to know. So my next question to you would be that you have published so many research papers in both national and international journals. You recently got a US patent, and you also got inducted in the Indian Chemical Society. So, sir, what is the most rewarding day of your career? What was like the day?
Okay. Again, like I said, I don't know. I mean, I before I answer that question, I don't know if you know about Professor Randy Posh, who died of pancreatic cancer. He was with, I think, Cornell University, a professor of computer engineering, who was one of the pioneers of virtual reality. So I know. So you should actually. I advise many of my students, even the undergraduate students whom I teach. I tell them to watch this YouTube lecture, which says the last lecture. The name of that lecture is the last lecture by Professor Andy Posh. So in that, it's probably 1 hour and little over 1 hour. So in that, he talks about achieving childhood dreams. So when I watched it for the first time, I could relate to him, right? So I mean, it's about childhood dreams. So as far as so all these years, leaving the mechanical engineering course, coming to pharmacy, and then coming to ICT, getting trained into drug design, and being the core member of the drug discovery team in various industries, including postdoc. Then after coming to academia, so my work has already, I mean, it was always related to drug discovery. So all these years, I always wanted to make sure at least some of my compounds go to clinical trials. So the most rewarding day, all this, throughout now I'm 44 years old. So all these years since my childhood, I think the most rewarding day as far as my professional activities are concerned is the day when we got the news that we actually got approval for the phase one clinical trials of one molecule which we have designed, and it's actually my brainchild. I was the first one to make it, and of course this is a project with a company and it's a team effort, but I can proudly say that the molecule was designed and first synthesized by myself. Even I have those pages where I, when I write down in the lab notebook, I have those pages. So we always dreamt of this day when this molecule would go to clinical trials, and the day when it happened, I think that was the most rewarding day. Of course, before that, we had a meeting with FDA, the Indian FDA CDSCO guys, so we could defend our molecule, and we got permission to conduct phase one trials. That was the first, I would say. And then after 2 months, we got another approval for phase one trials. That molecule is for COVID-19. Again, I was very perseverant in terms of pushing that molecule for getting tested for COVID-19, and it worked out. I wouldn't say it's a luck or something, but there was a solid rationale behind that. And Mr. Somaya, who is from Godavari Biorefineries Limited, or the chairman of Somaya Group of companies, so he actually made that happen because I mean it's their project. But then I work as a consultant with them. It's ninth or 10th year since I started working with them. So all these years, like these, I mean, the first day, like you asked me, when we got the approval for the IND, the phase one clinical trials for TNBC, triple negative breast cancer.
So that's great to know, actually.
Yeah.
So as I've also mentioned that you were AIR1 in GATE exam in 1998, and you have been in this field for the past 27 years. So,
Yeah.
so what advice would you like to give to undergraduate or graduate students or postgraduate students of pharmacy?
Yeah. See, again, many a times I tell my students, probably, they sometimes they don't understand when you tell them, very lovingly, then I literally have to shout to them. I tell them, so knowledge is what will make you, even if you are the ugliest person on this planet, but people will respect you for knowledge. And Google is not knowledge. Google is information. So you have to actually earn, or you have to acquire knowledge. Now, for acquiring knowledge, you have to work hard. It's not just reading, but you have to work on bench and whatever you have to do. So you have to actually work very, very, very hard. There is no shortcut to success. And then, of course, at this point of time, when you are beginning your career after your graduation, money is most important thing for you. But if you seek knowledge, everything will follow you. Everything will come to you at the right time. As in, you don't really have to stress yourself for that. So hard work and knowledge, these are the two important things. You should never, you should make it a habit to work hard. Again, people talk about doing it smartly and not like not doing the hard work or something. But believe me, no matter what field you are in, no matter what you are doing, there is no substitute to hard work. And of course, your passion for what you are doing. If you enjoy your work, I think that's the most important thing, irrespective of material gains. As long as you are satisfied from within, I think that's what is important. I mean, if you ask me at this point of time whether money is important to me, I mean, if you ask me to prioritize the satisfaction of what I do, my passion, money, I would, money probably would be probably somewhere down in the list. Not that I don't want money, or not that I am not, I mean, I wouldn't want it. It's just that because, of course, good research requires money. I would want money for sure. But then if I don't enjoy what I do, I think none of this matters. Even if somebody makes you the richest person in the world, of course, that's my feeling. Somebody else may feel the other way. As long as you have money, you do anything and everything. But for me, I think to be able to do what I do, to enjoy what I do, and all this has I have earned it from my hard work. And whether it is, whether it is time for me to slow down or stop, absolutely not. I mean, this is just the beginning. So as far as my message to the undergraduate students, or any student for that matter, is hard work, and do hard work, and seek knowledge. I think these are the two important messages I would give.
So I would definitely try to inculcate those in my life. Sir, as a person, you have both experience in the industry as well as in academics. I'm pretty sure that you have must face some challenges in your job. So, what was the most challenging day of your job, and how did you tackle the same?
In industry or in academia, or
Both, sir. Both, sir.
okay. So see, again, like I told you, uh, so to be able, so as far as industry is concerned, many a times you would want a certain idea to put forth, and then your boss wouldn't agree. So that was one challenge. At times I had, of course, I had most of my bosses were really awesome. They encouraged me, but there were one or two who were really a pain in the neck. So that was one challenge, to be able to not enjoy what you do just because your boss is telling. So as far as industry is concerned, that was one major challenge. Otherwise, all the industries which I worked for, they were fantastic industries. Money was not a problem in terms of when it comes to research. But this challenge, I mean, I always, all these years, I have learned that it's all people management. Whatever happens, it's all people manage. Everybody is smart. No, you can't say that this guy is dumb, this guy is not dumb or something. But it's all people management. Everything comes down to people management. You may be the next Nobel laureate, but if you cannot manage your team well, I don't think you will go that far. So managing people is one challenge which I also faced, and that's exactly where I said, talking to, I mean, to be able to be able to not enjoy what you do because the boss wouldn't agree, or the boss had his own issues. Not that the boss was wrong and then I was. It's just because the ego issues. I mean, human behavior is so complex, and at times we don't know why we behave at a particular time, or why the person next to you behaved that funnily. So that's where the managing people is a major challenge. As far as academics is concerned, the worst part is sometimes, I mean, it does happen if you are not prepared well and if you have to deliver a lecture. So at the end of the lecture, if I have that feeling that I did not do well, I think that is, that's very annoying feeling. And to avoid that uneasiness, we always make sure that we prepare well. But at times, because of some issue, something came in between and you could not really prepare well. So that is one challenge. Again, it is related to, I would say, time management as far as academia is concerned. People think that teaching is an easy job, but not anymore. There is so much teachers end up doing admin work, ranking this, that, so much. So managing the time is at times a major challenge. In academia, and many a times people ask you to deliver talks at their institutions, and I usually don't say no. So this is where things get a little off the track, managing the time. And I admit, I started believing that time management is actually a myth, but it shouldn't be that way actually.
So I saw on your profile that you are currently working on a project on preclinical development of a new chemical entity. So, and
Yes,
you have completed a project previously on the same topic. So, sir,
yes.
can you please elaborate about the same? Like, what do you
Okay.
actually do?
Yeah, so I told you about my the first approval, IND approval, which we got. So all the work which I am going to talk about is in collaboration with Godavari Biorefineries Limited, which is a company. The parent company is Somaya Group of Company. Mr. Samir Somaya, who is chairman of Somaya Group, so he's the owner, and it comes under his. He is the owner. So I started working with them, and so here, if you ask me, as in, can you repeat the question again?
So you're working on preclinical
So
development of
yeah.
a,
See,
yeah.
now I just went blank.
So, okay.
Okay. So here, what we are doing is, like when I joined them back in 2013. Well, 2013. So initially, I joined them. They did not know whether I could really contribute to the project. I wasn't sure whether whether I could do that, because so they had a natural product and they wanted to systematically optimize it so that it could be converted into a drug. So over a period of time, we modified it, and then we made it to work. And then we successfully completed the preclinical studies. It showed excellent activity in the animal models of breast cancer. So our focus is on a category of drugs called cancer stem cell inhibitors. Now, cancer stem cells are those cells which are responsible for relapse of cancer. I mean, it is this group of cells which are not killed by chemotherapeutic drugs, meaning anti-cancer drugs. And even if you remove the cancer, say a solid tumor by surgery, even if once cancer stem cell is left behind, it can give rise to a full-blown tumor, and that's how there is relapse of cancer. So this very bright biologist from MD Anderson, who is also founder of the biotech arm of Somaya Group of Company, that is, or rather Godavari Biorefineries Limited, that is Satgen Biotech. So he could be the next Nobel laureate, maybe after 10 years down the line. So his name is Dr. Sendurai Mani. He's a professor at MD Anderson Cancer Center in Texas. So this guy, he was working on one natural product, where he showed that it could potentially kill cancer stem cells. And the focus, as far as Indian population is concerned, was always on the triple negative breast cancer, because 50% of the women who get breast cancer, they suffer from triple negative breast cancer, and none of the medicines for regular hormone positive breast cancers would work on this. So they do not have any alternative but to die. So we wanted to develop agents which will kill these cancer stem cells. So we could combine them with the cancer chemotherapeutic drug. So cancer chemotherapeutic drug will kill the bulk of the tumor cells, and our molecule will kill the cancer stem cell. And this is exactly what we started working on this project, and the team was built, and everything went so nicely. So we could actually come up with this molecule, which is a very potent cancer stem cell inhibitor, and it acts by a novel mechanism of action. And then when we did the preclinical studies, we found it very safe. Just like sodium chloride, use it as much as you can, and nothing would happen. So it is that safe. But then it does its job of killing cancer stem cells very efficiently. So we got then we after the preclinical studies. In fact, Mr. Somaya spent so much money in getting the preclinical studies done. I mean, we were at one point of time. We were He was of the opinion that nothing is working out. We should stop and not worry about anything rather than go on spending money, because drug discovery is expensive. So, but then he just hold on because we persuaded him to. He said, let it be, as in it will happen, and fortunately, it happened as well. So then we applied to Indian FDA, saying that we have a molecule which is very safe, and which actually is also a very potent cancer stem cell inhibitor, and it is right for the Indian context, because I'm sure you all know about Somaya Vidyavihar campus. They're very people loving organization, in the sense they're philanthropists actually. They do a lot for the community. So Mr. Somaya had this dream of discovering a drug for Indian people by Indian people. So that's exactly how it. So his passion, we actually shared that passion. We share we Many a times we tell him that we share your passion of discovering this, or being useful to this world or to the people. And that's exactly how we went to Indian FDA. They had a review of our application, and one fine day, last year we got a permission to conduct phase one trials. In fact, the CGMP synthesis of that is over, and now in April, now the formulation will happen. And in April first week, we will dose our first patient of TNBC, that is triple negative breast cancer. So, and then so that was so it's a cancer stem cell inhibitor, and it is working fantastically. And we are just hopeful that it will also cross the phase 2 as well as phase 3 hurdles. None of the cancer stem cell inhibitors has so far reached the market. The most advanced molecule is in phase 3 trials. It is by a company called Boston Biomedicals, which is taken over by some Japanese company. I forgot the name. So it's in phase 3 clinical trial, which is a cancer stem cell inhibitor. And so hopefully in next 2 years, that drug will become a reality. And then we have this molecule, which is entering in phase 1 trials. And similar is the story for the second molecule, for which we have got the phase 1 permission for conducting phase 1 trial. So this other molecule is actually a viral entry inhibitor. It doesn't act on the viral target, so it prevents the entry of virus in the host cell. So no matter if in future we may have some other viral pandemic or so, this molecule will be ready to prevent the entry of the virus, irrespective of what that virus is, because viruses usually use the similar mechanism. I mean, I'm not saying they use a similar receptor, but they get internalized in the vesicle. This molecule actually prevents the rupture of that vesicle, so that the virus cannot enter inside the host. So,
That's a great answer. So I got to know so much about this, which I was completely unaware of. So, sir, as students, we look up to you as our mentors, as our teachers. So, who do you look up to the most, and what are some things that they have instructed you, which still remains close to your heart?
Yeah, of course, the most important gurus in my life, of course, are my parents. Like anybody, any individual on this earth, parents are the first gurus. My father, again, so I am from a lower middle class family. So my father has worked very hard to make sure that we all four siblings could get great education. My mother, she also, she worked very hard to make sure, again, for the same reason, that we could actually, get good education. So they are my first guru. So as far as hard work goes, I look up to my parents for sure. Then comes all my teachers, right from my childhood, from my school, from my college. Everybody, they help me. Like I said, I am from I was from a lower middle class family. So we had financial issues all the time, and then all my teachers, they did help. When I came to Nasik for my B Farm, so all my teachers were very, very, very strict, meaning we were so terrified even to be able to talk to them. I mean, ideally it shouldn't be the case, but they were very strict, and we just uh, grew up watching them. Meaning we used to only have 45 minutes in between our lectures and practical. And since we were staying in Nasik, so we used to go to eat in the mess. And that mess, it was like 15 minutes from where our college was, and that too if you walk very fast. So you go there in 15 minutes, come back in 15 minutes, and then 15 minutes to eat. No matter how fast you have to eat, we'll just come back, because the moment the time is beyond 2 o'clock, the teacher wouldn't take you inside the class, right? So very, very strict. So this is where I got my first lesson of discipline. Of course, discipline of I mean, your parents, your teachers, they make you. But then as far as my professional pharmacy is concerned, so managing as in be punctuality, that's one. And then respecting others time, so all those things I learned from my teachers from BFAM. When I came to ICT, my professor, Professor VM Kulkarni, again, he was very, very, very strict, actually. In fact, I remember my first entry, or when I joined ICT in July 1998. Yeah, he was in US. After he came back from US, I was so excited. I mean, all these years you studied so hard, stood first, and that person for whom you came to ICT. So I went to meet him. He was in his office. So then he didn't say a word. I told him, sir, I'm this. Yeah. He didn't say a word. He called other senior student, and then he said, "You tell him how to." How to behave in the sense, I did ask him where I can come in also, but he was probably busy. I did not know that, and I just barged into his office. So that's where I still remember those days. I mean, that day where he said, Vijay, tell him how to behave when he has to enter inside Professor Kulkarni's cabin also. But then he was a very good administrator as well. And he knew how to manage as in how to work with people. He was very good. Of course, he was very strict, and he was very, very he used to shout at a lot of people, but then he was equally loving as well, very caring. So I look up to him, Professor VM Kulkarni, my MPharm and PhD guide, and all my teachers back then. Professor Vavia has taught us, Professor Ladda, Professor Padma Devarajan, Vandana Madam. In fact, Vandana Madam, I have a very fond memory. So we, in second semester of masters, we had a subject as a seminar. So I talked on COX-2 inhibitors, and after my seminar, she came to me, and she had a pat on my back and said that, oh, you were so wonderful. I mean, you were so good in presenting your work. I still mention that to her many a times. So all my teachers from ICT, I mean, I look up to them. I learn a lot nowadays. Professor Joshi, after I joined here, fantastic person. As in the day I joined ICT in 2000, like October 19, 2019, and I met him on 1st October 2019. On that very day, the first time I met him during the interview, but there was no formal chat or something, as in a proper chat. So from that day, we became so good friends. So I look up to him for again understanding, or for knowing, or for learning how to how to take things ahead, how to keep your head cool. I'm very short-tempered person, but over a period of time, I have managed to do that. And so all these people have contributed to that. So I look up to my faculty colleagues, I look up to my teachers, my parents to do what I do. Not that I'm perfect or so, but then I try to imbibe them whatever is good. I try to take from them.
So my final question to you would be that apart from academics or pharmacies in general, what are your other interests in life? What do you do for recreation or leisure activities? What do you do?
Yeah, so I love hiking. That's my I would say my first passion in the sense, apart from research, or apart from my professional activities. When I was in ICT, we used to every 15 days. particularly during the rainy season. Every 15 days we used to go to all the major peaks around Mumbai and even Pune and Nasik. We have again this one was from Nasik. Also, we used to go. So Kalsubai, which is the highest peak in Sahyadri ranges, I have gone there twice. Again, it's not very difficult. I'm not saying I'm a mountaineer or something. Absolutely not. But I love hiking. I get I feel very peaceful when I do that. In quite some time, I haven't done anything like that before. I mean, anything like that in recent times. Other one is cycling. I love cycling. I do have a cycle, but again, don't really get time to go out and do that. And in fact, one day I would want to go to Mount Everest. That's my dream. I don't know whether it will be fulfilled, but in 2015 I went to with youth hostel. I went to a trek called Sandakfu, which is the highest peak in West Bengal. It was 7 day peak, and you walk along India Nepal border. So one day you are in India, the other day you are in Nepal, like, and that was so very cold. It was in December, so Kanchenjunga was very close from there. Although it was like 200 nautical miles, but you could see very clearly. You could also see Everest from there. You do see Everest there. That's my dream. Someday I would want to go to Mount Everest. I don't know. I mean, not to the summit, but maybe to some camp. I mean, base camp is easy probably, but at least some place up. I don't know, but I would want to do that someday. In fact, I think this week itself, I saw this movie by Rahul Bose, Purna.
Yeah, yes, sir.
Yeah. I literally cried watching that movie. Amazing. I mean, if there is a determination, nothing is impossible. Believe me, I would want to. And then again, the same thing came to my mind. I would want to do that someday. That's
Sir, I'm from Kolkata, so I've been to Sandakfu, so I really know what you're talking
you
about.
know what it is, yeah.
Yeah, and my father is also a very, like, he loves mountains, so he almost goes to trek every once a year.
Wow.
So I know what Sandakfu is because I've been there personally. I know what it's like to go on a trek.
Yes.
So that would be all from my side, sir. It was a really great honor to talk to you, to hear you. And we on Bombay Technologist, thank you for accepting our invitation.
Thank you,
Thank you, sir. Thank you, sir.
Okay, take care. And thank you, Ekta.
Thank you so
for
much,
being
sir.
so perseverant and
Thank you.
in a way, all my tantrums of time and calls and it's just, a lot of things come up and it's so difficult. I mean, I don't want to disappoint students, but then at times it becomes a lot. So thank you for bearing with me. I couldn't